Hey everybody, and welcome to my PTCB online study resource. My name is Adam and the YouTube channel is called PharmaLife. This is going to be part one. We're going to be discussing generic and brand names, classifications, and scheduling on drugs. Alright, to begin, we're going to be understanding and getting to know what scheduling drugs means. So the lower the schedule, the more highly abused it's going to be. So Schedule 1 drugs are going to be drugs that cannot be prescribed. These are going to be like street drugs, heroin, LSD, peyote. And I put marks around the marijuana just because I believe that this is going to be the one that will be changed eventually. There is a synthetic form that is a Schedule 2 drug and is used for, I believe it's nausea in cancer patients. Alright, Schedule 2 drugs are going to be medications that can be prescribed by a doctor, but they still have a high risk for developing substance abuse or use disorders. Drugs like this will include majority of the pain relievers that are very strong, ADHD medication. And cocaine is actually a Schedule 2 drug as well. It's used as a topical anesthetic and can be used during different kind of surgeries. Alright, next we move on to Schedule 3 drugs. This is going to be mainly prescribed for illnesses or injuries rather than health disorders, and these can still be highly abused. So we've got ketamine, anabolic steroids, Suboxone, and certain pain medications that contain codeine or hydrocodone. And majority of the time those are going to be way less in strength than the Schedule 2 drugs. Alright, Schedule 4. Same thing, they're just getting less addictive in properties. So these are going to be Xanax, clonazepam, diazepam, Valium, or Ativan. Alright, now we've got Schedule 5. This is going to be the last controlled substance, and these can still be abused, but they're the lowest risk for substance abuse. So drugs would be Lyrica, Lamodal, Robitussin AC, and many more. Alright, and finally we've got non-controlled substances. These are going to be for like health maintenance. They can also be over-the-counter stuff. So they don't usually show substance abuse. However, some people can still abuse some of the drugs. But drugs include like Viagra, Albuterol, omeprazole, Tylenol, and amoxicillin. Alright, so now the bulk of this video is going to be, I'm going to discuss the top 100 used drugs. Now this is probably not going to be as accurate as I want it to be, just because regions differ in different kind of health issues. So this is just what I found to be close to about the top 100. I've added a couple more, so it's more like 106 or so. But it's just what I feel is the most top used drugs in the Alabama region. So the way that I explain people how to really memorize and understand drugs, generics to their brand names, is just to work with them. If you're allowed to work in a pharmacy before you take the exam, I highly advise you to get one, maybe 3 drugs a day and just learn what they're used for, their generic names versus their brand names. This is going to help you a lot when you're taking the exam. Alright, so to start, we are going to go through the ACE inhibitors. We've got lisinopril, brand name is going to be Prenavil. The function, of course, is ACE inhibitor. All these are going to be ACE inhibitors. Next one is going to be enalapril, and the brand name is Vazitech. Third, we've got Ramipril and Altase. Alright, we've got alpha receptor agonists. We've got clonidine as Catapress. Alright, next we've got Angiotensin II Receptor blockers. We've got Valsartan, brand name is Diovan, and then Losartan, and the brand name is Cozar. Next we've got commonly used antibiotics. We've got amoxicillin, brand name is Amoxil, and this is a penicillin. Next we've got azithromycin, brand name is Zithromax, and it is a macrolide. Next we've got amoxicillin mixed with clavulanic, brand name is Augmentin, and this is also a penicillin. Then we've got cephalexin, brand name is Keflex, it's a cephalosporin. We've got ciprofloxacin, brand name is Cipro, it's a quinolone. Doxycycline, brand name is Vibromycin, and it's a tetracycline. Finally, we have sulfamethoxazole mixed with trimethoprim, brand name is Septra, and it is a combination of antibiotics. Next, we're going to be talking about anticonvulsants. We've got gabapentin, brand name is Neurontin, and this is a Schedule 5 drug. We've also got pregabalin, which is Lyrica, and it is also a Schedule 5 drug. We've got antidepressants. Citalopram is Celexa, and it's a SSRI. We've got trazodone, which is Desiril, and it's an antidepressant, but it can also be used as a sleep aid. You'll see this again later on in the video. We've got duloxetine, which is brand name Cymbalta. We've got amitriptyline, which is Elavil. And we've got venlafaxine, which is Effexor. Next, we're going to be talking about anti-diabetics. We've got metformin as glucophage. We've got glimepiride as Amaryl. We've got pioglitazone as Actos. And we've got glyburide as Diabeta. Next, we've got antifungals. Fluconazole, brand name is Diflucan. Antihistamines, we've got fexofenadine, which is also Allegra. We've got two anti-nauseas, promethazine, brand name is Phenergan, and we've got ondansetron, which is Zofran. Antipsychotics, we've got quetiapine, brand name is Seroquel. Antivirals, we've got valacyclovir, which is Valtrex, and we've got oseltamivir, which is Tamiflu. Next, we've got ADHD medications, drugs such as methylphenidate, which is Concerta, is a Schedule 2. Amphetamine salts, which is Adderall, is Schedule 2. Dexmethylphenidate, otherwise known as Focalin, is also Schedule 2. And lisdexamphetamine is Vyvanse, as a Schedule 2 drug. B2 receptor agonists, these are going to be for your lungs, and it's going to be Albuterol. So Albuterol has multiple brands out there, ProAir, Proventil. In this case, those are going to be the B2 receptor agonists. But we'll come back to Albuterol in just a couple minutes. Next, we have benzodiazepine. We've got alprazolam as Xanax, and these are going to be Schedule 4. Clonazepam, brand name is Klonopin. Lorazepam, brand name will be Ativan. And diazepam as Valium. We've got some beta blockers. Atenolol, brand name is Tenormin. Metoprolol, brand name is Lopressor. And Carvedilol as Coreg. Now there's going to be a whole bunch of birth controls out there. I've only included one just because I feel like this is the most common that you'll see. So we've got ethinyl estradiol plus drospirenone, and the brand name to that is Yaz. We've got bone resorption inhibitors. This is going to be for, most of the time it's older women, but it can also be used by males as well. and generic to that is alendronate. Brand name is Fosamax. Alright, next we've got bronchodilators. So we've got fluticasone and salmeterol. Brand name to this is going to be Advair, and it's actually a bronchodilator and a steroid combination. And like I said, we're coming back to Albuterol. It can also be prescribed as Venolin, which is also a bronchodilator. Calcium channel blockers, we've got amlodipine as Norvasc. Corticosteroids, we've got prednisone, which is Steripred. And we've got mometasone, which is Nasonex. We've got some diuretics, drugs such as hydrochlorothiazide, otherwise known as HCTZ. Brand name to that is Microzide. We've got furosemide, which is Lasix, triamterene, which is Diurenium, and spironolactone, which is Aldactone. We've got electrolytes, which is drugs such as potassium chloride. Most of the time, if you're working in a pharmacy, you'll either see Chlorcon or the drug will be called potassium chloride. Alright, erectile dysfunction drugs. We've got sildenafil as Viagra, and we've also got tadalafil as Cialis. Next, we've got estrogen replacement. Generic to this is going to be conjugated estrogen, and brand name to it is Premarin. Histamine blockers, we've got ranitidine. Brand name is Zantac. Hormone replacement, we've got levothyroxine as Synthroid. There's also another one that you'll probably see is called Armour Thyroid. Alright, next we've got inhaled steroids. Steroids such as fluticasone, which is Flonase, and triamcinolone, which is Nasacort. Now with the insulins, it gets pretty complicated. I've chosen the top 3 that I've seen the most. There is a ton of insulin out there. Alright, so we've got insulin glargine, which is Lantus. We've got insulin glucine, which is Apidra. And we've got insulin Lispro, which is Humalog. We've also got digoxin, which is Lanoxin, and it's an inotrope. We've also got leukotriene inhibitors, drugs such as Montelukast. Brand name is going to be Singular. These are for allergies. We've got mineral supplements such as folic acid or Fulvite. And we've got muscle relaxants, drugs such as cyclobenzaprine or Flexeril, and Carisprotol, which is Soma. Now the Soma is actually a Schedule 4 drug. We've got nitrate vasodilators, drugs such as isorsabide, mononitrate. Brand name is Imdur. And we've got NSAID drugs, such as ibuprofen, otherwise known as Advil, meloxicam, which is Mobic, naproxen, also known as Aleve, and celecoxib, also known as Celebrex. Alright, we've got the pain relievers next. So drugs such as hydrocodone and acetaminophen. Acetaminophen shortened is APAP. But brand name to that is going to be Norco. That's a Schedule 2 drug. Oxycodone with acetaminophen is Percocet, another Schedule 2. Tramadol, which is also known as Ultram, is a Schedule 4. Propoxyphene and acetaminophen is Darvocet, Schedule 4. Codeine with acetaminophen, otherwise known as Tylenol 3, is a Schedule 3. And oxycodone, which is also known as OxyContin, is a Schedule 2. We've got a couple of blood thinners, clopidogrel, known as Plavix, and warfarin, known as Coumadin. Next we've got prostate receptor agonists, drugs such as tamsulosin, otherwise known as Flomax. Proton pump inhibitors include omeprazole, brand name is Prilosec, esomeprazole, which is Nexium, and lansoprazole, known as Prevacid. We've got selective serotonin reuptake inhibitors, SSRIs. We've got sertraline, known as Zoloft, escitalopram, known as Lexapro, citalopram as Celexa, fluoxetine as Prozac, and paroxetine as Paxil. We've got sleep aids, Zolpidem as Ambien, this is going to be a Schedule 4, temazepam as Restoril, this is going to be a Schedule 4 as well, and trazodone, known as Deseril, is just a prescribed sleep aid, but it has no control, so it's a Schedule 6. Next, we're going to be talking about statins. Statins are easy because they have statin in the name, but this is also going to include another cholesterol medicine. But basically what the statins do is help improve your cholesterol. So simvastatin, we've got Zocor, we've got atorvastatin as Lipitor, we've got pravastatin as Pravachol, rosuvastatin, Crestor, we've got lovastatin as Mevacor, we've got ezetimibe with simvastatin as Vytorin, and we've also just got ezetimibe by itself as Zetia. Next, we've got steroid anti-inflammatories. Drugs include methylprednisolone, which is also known as Medrol. And finally, we've got xanthine oxidase inhibitors. Drugs include allopurinol, and brand name is going to be Xyloprim. So that's going to conclude this video. I'm going to try to upload videos daily until I've got the whole entire guide to my best knowledge posted. This is 100% a study resource for you if you are a visual and auditory learner, and I know some people might question some of the prices that are out there for certain study guides, so this is going to be 100% free. It's just my knowledge to you. So with that, best of luck in taking the exam. Hopefully this has helped you a lot, and just be on the lookout for the next video. Thank you guys so much for watching.